because they always end up lying to you, saying like, if you have like a sickness, they won't tell you exactly what it is. They'll beat around the bush before they tell you exactly.
I feel sometimes when I go to a doctor, it's a little bit of an in and out kind of thing, and there's not a real genuine personal interest sometimes.
These interviews speak to a vast disconnect between patients and doctors. Not only do patients have a deep-seated mistrust of their doctors, but doctors also don't understand the knowledge level of their patients. This disconnect is a leading factor in the public health crisis that is medical non-adherence. Don't let this clinical terminology fool you. This is a serious problem that causes over 125,000 deaths every year in the United States alone. Medical non-adherence is an issue where patients don't take their prescribed medicine, and it's draining the lives of people and the resources of the medical industry as it causes losses of over $300 billion every year.
Doctors who understand their patients' health beliefs are better suited to balance differences between their personal views on respective illnesses and their patients. With a better understanding, these physicians can better determine treatments most relevant to the patient's subjective needs, as dictated by their circumstances and ideologies.
To facilitate these ideal relationships, we are proposing 2 surveys as a solution. Patients will download an app to fill out these surveys a day before their appointment. The first will be a comprehensive open-ended quiz testing patients' knowledge of their respective conditions. Doctors receive these results and can determine which aspects of the condition and treatments they should focus on with their patients upon meeting them. This will help bring about a more effective and direct means of communication within the context of patients' medical conditions. The second survey functions as a test for patients so doctors can best plan their course for communication. This survey will test patients' sentiments regarding the medical industry, such as trust for their doctors and medication, among other important factors. We will be basing the formation of these questions on findings from Dr. Richard L. Street and Dr. Paul Hyded. Their research has provided great insight into the subject of enhanced communication between doctors and patients. Our company would apply these resulting answers to an algorithm to determine a patient profile based on these factors, so doctors can best tailor their approach to communicating with their patients in a broader sense.
In order to fund our project, we would partner with local hospitals who would pay us $10,000 a month in exchange for our patient analysis. Our fee would be much less than the massive financial losses hospitals deal with due to non-adherence. With 113 hospitals in New Jersey, our company would have a large operating budget of over $10 million a year, more than enough to pay a team of data analysts, app designers, researchers, and survey designers. The cost of app maintenance and running a server for a small app is usually under $100,000 a month, which would be well within our budget. We're the only ones currently tackling medical non-adherence by attempting to bridge the divide between doctors and patients. We hope to use this nuance to bring about true change and save thousands of lives.